When it comes to recovering from an injury or managing a chronic pain issue, many people turn to physical therapy to help them regain strength, mobility, and function. While physical therapy can be an effective treatment on its own, research has shown that adding medical massage to the mix can lead to even better results than just by doing physical therapy alone. But why is this the case now, and why hasn't this always been the way? Well, in this video, we're going to talk about the various ways in which medical massage can complement your physical therapy routine and enhance the overall effectiveness of your treatment series. Now, before diving into the specifics of how medical massage can benefit physical therapy, it is important to understand exactly what is medical massage and how it's different from other forms of massage therapy. Because unlike a relaxation massage, aka Swedish massage, which is designed to promote overall circulation and cause physical and mental relaxation during the massage time, medical massage is focused on addressing and improving specific musculoskeletal conditions and injuries. Medical massage is often given by massage therapists who have received specialized training in the field of medical massage, and they are specialized in knowing what strokes to use in order to improve various conditions to get specific outcomes. Sometimes medical massage can be recommended by a physician or other healthcare provider when appropriate. Medical massage includes a variety of different techniques such as deep tissue massage, trigger point therapy, and myofascial release massage, just to name a few, and it really depends on the needs of the individual, and it's often administered in a clinical setting. So, what makes medical massage such a valuable addition to physical therapy? One of the primary goals of physical therapy is to reduce pain and muscle spasms, which can interfere with mobility and function. Medical massage can help to alleviate these issues by releasing muscle tension and promoting muscle fiber relaxation in a way that physical therapy exercise cannot. Remember, an exercise does not always reduce the tension in the muscle and is more likely to promote relaxation in the opposite muscle, the opposing muscle. For example, if physical therapy is focused on the biceps, then the triceps muscle will be lengthened as a result of all the focus put in the bicep muscle, like in this particular case. Let's talk about how medical massage will improve your range of motion, because many people who undergo physical therapy are working to improve their range of motion, whether it's due to an injury or a chronic condition. Medical massage can help to increase flexibility while improving mobility and range of motion by stretching and manipulating of the muscle tissue and the surrounding tissues during a massage treatment, which, if done right after physical therapy session, is going to get the most out of both the physical therapy session and the medical massage treatment session. Did you know that medical massage enhances recovery time? Physical therapy, it can be physically demanding, to say the least, and it's important for the muscles to have time to rest and recover between sessions in order to make progress. Medical massage can aid in the recovery from physical therapy exercises by reducing muscle tension, increasing blood flow, and promoting muscle fiber repair, which helps the body to recover faster and more efficiently. Medical massage also works to reduce scar tissue. Scar tissue, it can form as a result of surgery or injury, and it can limit mobility and cause discomfort. Medical massage can help to break down scar tissue and improve its appearance, making it more flexible and less noticeable. In this particular case, you'll need medical massage to reduce the scar tissue because there is no physical therapy exercise on record that is proven to reduce your scar tissue. Quick little fact for you. Also, over a long enough timeline, medical massage promotes relaxation of the muscles and the mind. Physical therapy can be stressful physically and mentally. Medical massage can help to reduce accumulated stress and promote relaxation, which can be the difference between enjoying those weeks that you're in physical therapy and not enjoying those weeks. Besides, surgery and physical therapy are very stressful events, so use medical massage just to make your recovery days more enjoyable and less stressful in that physical sense. So, in my professional opinion, adding medical massage to physical therapy will lead to better outcomes and faster recovery. This is by addressing specific musculoskeletal issues, reducing pain, muscle spasms, improving range of motion, enhancing muscle recovery, reducing scar tissue, promoting muscular relaxation. This is all medical massage can do to complement physical therapy in all those ways. So, schedule your medical massage therapy in New York City at our website, elitehealersportsmassage.com, to get the treatment you need today. Now, please remember, if you're considering physical therapy and are interested in incorporating medical massage, be sure to discuss your options with your therapist, doctor, or healthcare provider if you're not sure, because together you can determine the best treatment plan for your needs and goals. Now, what I want you to do is click on this video called How Often to Get a Massage to learn the proper frequency for getting massage therapy during your recovery process. Thank you for watching, and I'll see you in the next video.